President Joe Biden is considering treatment options as he battles an aggressive form of prostate cancer. In a statement, Biden's office says he was evaluated last week for a prostate nodule after reporting symptoms. On Friday, the former president learned his prostate cancer had spread to his bones. Joining me is Dr. Matthew Ferroni, a urologist with Mercy Urology Clinic. Dr. Ferroni, thank you so much for taking the time to be here and speak with us more closely about this. Can you elaborate for us on what this diagnosis means for the president and the potential next steps for him?
Sure, absolutely. Thanks for having me. So the president was diagnosed with a pretty aggressive form of prostate cancer. It is spread outside the prostate to the bones. Okay. That's a common spot where prostate cancer is going to go if it's aggressive. The details are still coming out, but what's known is that President Biden has a Gleason 9 prostate cancer. The Gleason score is a score we use to characterize the aggressiveness of prostate cancer, basically under the microscope between 6 and 10. So at a 9, his cancer is pretty aggressive. Higher risk cancers have a chance to break outside the prostate and spread, which is why it's critical to find them as early as we can while they're still contained within the prostate.
I wanted to ask you about that Gleason scale because I'll be honest, I had not heard about it or heard much about it before this. So I guess, what exactly is it? I know you mentioned it's kind of measuring and the severity.
Yeah, it's every cancer has their own grading system. Gleason score is specific just to prostate cancer. When the pathologists look at a specimen, often from a biopsy under the microscope, based on how irregular the glands are of the cancer, they assign it a score essentially that ends up being between 6 and 10. And that score generally guides treatment. How aggressive the cancer is means some things may or may not be appropriate for the patient, like surgery, radiation, hormone treatment, those kinds of things.
And according to the American Cancer Society, prostate cancer is the second leading cause of cancer death in American men, only behind lung cancer. And you mentioned the spread, and that's what I'm understanding why it can be so fatal is because it tends to spread faster?
Yeah, so I think there's a misconception that prostate cancer is always a slow-growing indolent disease, that most men die of other things. And that's true for a lot of men, but prostate cancer can be aggressive and it can spread very quickly, which is why screening is super important. We recommend men start being screened at age 45 if they have average risk, meaning no first-degree family members and they're non-African American. African American men or men who have a father or brother with a history of prostate cancer should be screened as early as age 40. Because again, finding cancer as early as we can means that we can treat it before it has a chance to spread outside the prostate.
Real quickly, you talked about the screening, but also what are maybe some symptoms that people should be looking out for, saying, oh, I need to go in?
Yeah, we say to guys all the time that the most important aspect of a screening test is to find cancer before it causes symptoms. Oftentimes with prostate cancer, and we may be seeing this with the president, by the time it causes symptoms, it may be too late. So it's important to get screened even before there are any symptoms going on. So important to talk to your doctor on an annual basis about screening.
Okay, talk with your doctor. Great advice. Dr. Matthew Ferroni with Mercy Urology Clinic. Thank you so much for coming in today.
Yeah, thank you.
We appreciate it.